Thanks for joining us today. Can you give us your full name and the name of your business, please?
Yes, my name is Dr. Alan Knecht, and the name of my business is Namaste Chiropractic.
Wonderful. And what do you love about your business?
Well, I have to pinch myself. I get to do what I love. I get to help people on their path and journey to health. And I love the fact that it's an adventure every day that I come to work and get to celebrate the wins and help people who are struggling to reach their wins.
Nice. That's lovely. And have you been able to still help people during the COVID crisis?
We have. Chiropractic was deemed essential services by the governor of the state of Oregon, by FEMA, and by HHS on a federal level. So we chose to keep our doors open during the crisis. Our schedule dropped by about 50% because a lot of people were sheltering at home. But it's been exciting to be here and to help people.
I can imagine. I'm sure a lot of what you do really helps with the immune system and so forth. So I'm sure it's a huge benefit.
Right.
Wonderful. What challenges are you facing right now?
Challenges are probably going to be typical, like for most medical offices, making sure that we're creating safe distancing for our patients throughout the office, getting used to wearing masks. Surgical masks for ourselves, our staff, and our patients. Some patients come in with masks, some don't. But the challenges of getting up to speed with creating a safe environment, such as we check everyone's temperature, forehead temperature, as soon as they enter the office. We have policies in place to address people who have a temperature. Knock on wood, we have not had anyone with a high temperature to the office. We've asked people, if they do, to either stay home or not enter the office, so the doctor can call and triage them. And then the other challenge is getting up to speed with telemedicine. That's a new service we're offering here.
How is that going? Tell me a little bit about how that works.
It's great. In fact, I have 2 office visits via telemedicine right after this recording.
Wonderful.
And our patients seem to love it. We can't put our physical hands on our patients, but we practice something called functional medicine, which is whole body healthcare, and we can review laboratory tests with them. Most of our nutraceutical supplementation that we recommend is based on blood tests, and we use that to guide their physiology to better functioning. So we can make recommendations for nutraceuticals. And the main issue right now with the pandemic is stress. All of us are going through stress, and it's a form of slow roll PTSD. My patients call it coronavirus stress disorder. But I'm not a therapist, but in our functional medicine paradigm, we do have a very powerful stress reduction tool called neuro-emotional technique. And the website for that is www.netmindbody.com. That's NETMINDBODY.com. And if you navigate to that website, there's a drop-down menu for patients. And within there is a tab for wellness check. It's an online wellness check that patients can fill out based on their symptoms. And that will be emailed to both our client or prospective patient and our clinic. And then we can schedule a telemedicine visit to go over how stress is impacting their physiology and different options to help address that.
Wow, that sounds amazing.
Yeah, in fact, there's a home tool device that our clients and the general public can use in dealing with stress. And the name of that tool is an acronym. It's called FAST. And each letter stands for First Aid Stress Tool. And there's a website to that name, www.firstaidstresstool.com. And there's a little video and some printout material, and that's actually the tool that we're using on our telemedicine visit, where the doctors we are working with our clients to guide them through that process, so they can start. They have a tool that they can learn to use at home to deal with any stress, whether it's the stress of the pandemic, stress of normal daily life, job stress, health stress, relationship stress, financial stress. We all have these stressors. Sometimes it's hard for us to not take on the stress. So this is a tool to help us shed some of that stress and stay on our course, our true north.
Well, that sounds amazing. I can't think of one person that that wouldn't benefit. We all, like you said, we all have stress. So that would be amazing. So you had mentioned a little bit of telemedicine that you're doing, and of course, taking temperatures and other things. But what other ways are you adapting your business during this time?
So the short answer is seizing the opportunity. And if it's okay with you, I'd like to share my screen.
Absolutely, that'd be delightful.
We're going to share a screen here. Oh, it looks like you need to enable me to share my screen.
Probably do. Okay. You should be able to now.
Okay, so I'm going to share my screen here, and we're going to do that. Excellent. So what you're looking at is a document that I've created that I have, I've been participating. I belong to a nonprofit research foundation called the One Research Foundation. And it's a nonprofit that generates funds to publish research on that neuroemotional technique that I talked about. And I've been on a panel discussion once a week to support other doctors that do this tool. And on one of my presentations, I talked about the word crisis or adversity or struggle, okay? So my philosophy in life, when I come up against a crisis or a struggle or a adversity, is to look for what's contained within it. One of my mentors instilled in me the idea that within every struggle or crisis or adversity is a seed of equal and greater opportunity. So we have two choices, and then I'm going to refer to this document that I created for that presentation. So the word crisis, when written in Chinese, is composed of two characters or two letters. So like in English language, my name is Alan, 5 letters, A-L-L-E-N. In Chinese medicine, there's only 2 letters that represent the word crisis or adversity. And those are, the first symbol is danger. And then the second symbol or letter in the word crisis is opportunity. But if that middle image, you can see I'm kind of running my cursor around it, they're not equal. So where does our energy go? It's very easy when you're in the middle of a crisis or adversity to have your energy sucked into the danger, trauma of it. It's harder, but much more rewarding to focus our energy on the opportunity. And I call it seizing the opportunity. So we're presented with a crisis, whether it's in my office, whether it's the general public, whether it's personal or the clients I work with, whether I'm working with my clients one-on-one, face-to-face here in the office during the pandemic, or I'm doing a telemedicine visit, I always try to end my visit with helping them understand that there is a silver lining. There is an opportunity. We just got to look for it.
Exactly.
So that's one thing that's changed. And I bring up the word opportunity because one of the positive things coming out of this from my office is better hygiene. As physicians, we're now really making sure that we're using hand sanitizer frequently during each office visit. When a patient leaves my room, I wait till my next client comes in and they watch me wipe down my table. So they're rest assured that the table is clean. They watch me use the hand sanitizer. So it's little things that we're all aware of, and it creates more confidence. So I truly believe that the greater the adversity, the greater the crisis, the greater the opportunity that we can seize. And I'm kind of holding my breath or not, looking for the adventure of what this whole crisis, what opportunity it's going to bring to us when all the dust settles. We're already seeing positive opportunity. The world is breathing. The pollution is just plummeting. Greenhouse gases are plummeting. There's so many positive things that are happening in the midst of all the pain and suffering. So I try to do my part for myself personally and everyone I work with, to help them look for the opportunity so we're not defeated by it. I'll stop the share here somehow.
What a beautiful mindset. I really like that a lot. I but agree wholeheartedly with you. This time has given a lot of opportunity to a lot of people, and I really see it tapping into a lot of creativity as well. So that's a beautiful thing. So thank you so much for sharing that. It kind of ties into my next and last question for you is, what piece of advice would you give to someone who's struggling right now?
Well, I think I just gave it. Uh,
Yeah.
to number one, I'll recap it, rephrase it actually. It's okay to be stressed. You have a right to be stressed. It's okay to be worried. It's okay to be discouraged. It's okay to feel hopeless. These are natural feelings. And in the midst of the anger and the sadness and the hopelessness and the discouragement, you also have a right to have hope, to
Mm-hmm.
trust that we're going to come out of this, to trust there is an opportunity that we can seize. Um, there's so many self-empowerment things you can do. There's been some exciting research that's coming out almost every week. Just since the crisis hit at the beginning of the year, there's been 6 brand new research studies on vitamin D alone. Now, I'm not making any promise to cure anything, but the research is showing that there's a huge correlation between low vitamin D blood levels and mortality, fatality from the coronavirus. And the
Wow.
emerging data is also showing us that people are not necessarily directly dying from the virus itself. It's the body's immune response to the virus that is causing severe lung damage, heart damage, damage to the kidneys, damage to the blood vessels, creating blood clots and this new thing called children's COVID toes. Well, what all the research studies that are emerging from the data that's coming out from people that are getting very ill with the virus is that it's the immune system is being triggered into what's called a cytokine storm. And that's an autoimmune reaction by the body. The body's trying to kill the virus and it goes haywire, it goes in overdrive. And prior research for many years has demonstrated that vitamin D kind of helps put a lid on that, or is the turnoff valve for the autoimmune system. It helps prevent the immune system from going into that autoimmune state. For years in functional medicine, we've kept our patients on relatively high dose vitamin D levels to get their blood test on the vitamin D at the upper normal range on the blood test. The average American vitamin D blood status test is between 25 and 32, and normal range for most labs is 3200. So
Wow.
just getting it into the normal range helps. If you really want to help prevent and protect yourself and give you a sense of safety and security during this crisis, I'd
Mhm.
recommend that you work with a professional physician on monitoring your blood vitamin D levels and supplementing enough to get your vitamin D at the upper range of normal to protect yourself.
Yeah.
These are just a couple of things that we've seen and how it's changed our practice, and we can help patients in person or over telemedicine visit to
Oh,
evaluate their vitamin D status.
nice, nice. So that is the service that you provide
Yeah.
is that. Okay, wonderful. So it sounds like you're really doing a fascinating and amazing job of not only taking the physical aspects of a person into account, but that emotional side too, especially during this frightening time for many people.
Yeah.
So that's amazing. That's
and,
really
and we're even able to help them physically if they're having back pain or
mm,
neck pain or headaches. We can give them some self-care instructions. We have um, access to a company called Web Exercises, so we're able to prescribe custom exercises they can do at home to help alleviate their pain.
wonderful. That sounds great. Well, is there anything else that you'd like to inform us of before we end the call today?
I think my final message is a message of hope that we are going to get through this. It's a very contagious virus. The research shows that it's very likely the entire world population will be exposed to this within the near future,
Mhm.
and that the vast majority, they're saying 90%, will have no symptoms or extremely mild symptoms. But unfortunately, there will be about 10% that will have moderate to very severe symptoms, and tragically, some will die. And
Mm.
we're trying to do our part to help protect the people we work with and get the information out there that there are things you can do at home to support your immune system. We can't promise a cure for anyone, but maybe there are some things that you can do to help protect your support and protect your immune system to ultimately help you thrive, even if you get very sick.
Absolutely. I think that's great advice anytime, but especially during this difficult time. So thank you for that. All right. Well, thank you so much, Dr. Ellen. It's been a pleasure to speak with you today, and I look forward to seeing you again soon.
Very nice to speak with you too. Thank you.